know someone who suffers from sciatica, which is pain in the low back going down the leg, or someone who has neck pain that shoots down into the arm, those types of symptoms are usually associated with a bulging disc or an injury to the discs of the spine. I'm Dr. Jeff Schels, and we've helped thousands of patients with problems like that in the past. So I just want to take a few minutes and explain exactly what causes those types of injuries, as well as what people can do to actually get out of pain and then fix the underlying structural problem that is the cause. So the way that the spine is made up is that your spine is made up of the bones, which are called vertebra, and in between the bones are these little shock absorber disc pads, which are made of more of like a cartilage type material. And what the discs do is since they are flexible, they allow your spine to move. And in between every vertebra, right behind the disc, are the spinal nerves that come out. And these are the nerves that connect your brain to all the muscles, the ligaments, the tendons of your body, as well as all of the organs inside of your body as well. So what can happen, whenever your spine is lined up, and from the back it should be straight. Now from the side, you should have these three curves. So let's say though, in the lower part of your spine, so this is the low back, it's called the lumbar region, but that just really means low back. So there should be a nice curve in the lower part of your spine, but let's say because of some reason, maybe it was an injury, maybe that it was just kind of the way that your body developed, that you have a reduced curve and the lower part of the spine is straighter than it should be. Because of the way that the vertebrae are lined up, whenever you lose that curve in the lower part of your spine, what it does is it puts pressure on the discs to be pushing backwards. And when we look at the disc, the outside of the disc is made of a tough stringy material, and the inside of the disc is more of a jelly type material. So what happens is when you lose the curve or have a reduced curve in the lower part of your spine, it'll start to push the jelly type material against the tough stringy fibers in the back. And what'll happen is eventually they will start to tear some of those fibers. And when that happens, it's very common for a person to have an episode of back pain. Maybe they kind of throw their back out, and for a day or so they have a lot of back pain, but then maybe the pain goes away. However, the disc didn't go back to its normal position. It's still in the bad position. It's just that all of the swelling and those kind of things went away. So the person goes for a while without pain, and then they have another episode of back pain, which could be a year or two later. But what happened there was the jelly material tore through some more of the fibers, and then the pain went away. So a real common pattern that we see is the person comes in and they have back pain shooting down the leg because eventually the disc will start to bulge back enough to where it hits the nerves, which make up the sciatic nerve, which is where it comes out and goes down into the leg. So a real common pattern is a patient comes in and let's say they have a lot of sciatica, which is that pain going down the leg. But when you really start to get into their history, you find out that for years they were having these episodes of back pain. And eventually it started to go into the leg and a little bit into the leg, then eventually farther into the leg. And every time that happened over all those years, this problem was slowly but surely getting worse and worse and worse till eventually it's going down the leg and it's not getting better, and that's whenever they may come to us. So what we do is we take the patient's history, do a very thorough exam, and then take x-rays of the spine. And whenever we do diagnose it as a bulging disc, or you may have heard of a herniated disc, which is even worse than a bulging disc, what we often find is they have that reduced curve and this pressure on the discs where the sciatic nerve is being pinched. The good news is the majority of those types of conditions don't require surgery. Now some do, but the majority don't, and we're able to help those people. So if we do accept them as a patient, the first goal is to get them feeling better, which is the way we do that is by getting the pressure off the nerve, reducing the inflammation, But ultimately, if a person really wanted to fix the problem, they would have to not only get out of pain, but they would have to get more of a curve in that lower part of the spine so that it puts pressure on the disc going back forward again so that the problem doesn't come back. So if you or someone you know has a history of a disc injury that they know about, or they suffer from sciatica or back pain, we'd love the opportunity to help them. It always starts with finding out exactly what the problem is, and we can do that for them. So have them give us a call at 254-778-2225. Thanks, have a great day.